We turn now to the coronavirus pandemic. Vaccination rates are losing steam across the country. So far, more than 42% of the population is fully vaccinated, and nearly 52% has gotten at least one shot. Experts are urging people to roll up their sleeves as a dangerous variant threatens to throw another, quote, curveball into the nation's recovery. But there is some positive COVID news. Anna Werner reports from San Francisco.
Across the country tonight, vaccine rates are dropping. Less than 400,000 Americans are now getting their first shot each day. In April, it was nearly 2 million. The fall-off threatens the Biden administration goal of getting 70% of adults one dose by the 4th of July, a target that could create so-called herd immunity. But that protection varies wildly. In Alabama, just 38% of adult residents are fully vaccinated. In California, it's nearly 54% among those eligible. San Francisco is 69%.
Are people in San Francisco safer from getting sick?
Yes, they are, without a doubt.
Because?
Because the level of immunity is so much higher. We're so much closer to herd immunity.
California plans to lift all COVID restrictions in less than a week. But the rapid growth of variants troubles doctors, especially the Delta variant first identified in India.
One of the things that COVID has proven is it's really good at curveballs.
Meanwhile, millions of Johnson & Johnson doses sit on shelves, many about to expire. A possible solution, extending the expiration dates.
They need to look at the science. We don't want to push the expiration date if it really isn't as effective anymore.
For people who are still unvaccinated, more states are offering incentives. Cash lotteries, free beer, and in Washington state, free pot, a promotion called, of course, Joints for Jabs. Former Surgeon General Jerome Adams questions those tactics, tweeting, "I'm just really starting to get uncomfortable with the public health trade-offs here, and the messages we're subtly sending our youth. Is it really worth it?" In San Francisco, Mayor London Breed says there are still residents to reach.
The fact is, we still have a huge population of people who still need to be vaccinated.
Even here with those high vaccination rates, data shows 10% of San Franciscans aged 65 and older have yet to receive a vaccine shot. That's compared to about 13.5% nationwide. Lana?
Anna, very interesting. Thank you. Dr. Hlatshwayo Davis joins me now. She's an infectious disease physician at John Cochran VA Medical Center, as well as a member of the St. Louis Board of Health. It's great to have you with us. So experts say San Francisco is on track to be the first major city to hit herd immunity in the U.S. Remind us, why is herd immunity important, and how do you know when you've reached it?
Herd immunity is crucial, Lana, because that's how we know that we've reached our new normal. It is an approximate number, let's be clear. It varies from country to country depending on their population, vaccination rates, and what's happening with the pandemic. But once we do reach herd immunity, what that tells us is that we have community protection so that even those who are not vaccinated get that measure of protection from the vast number that have. Such an important milestone for us to reach in order for us to reach our new normal and to regain some sense of normalcy in public. I'm so pleased to hear this in San Francisco when we think about some of the difficulties they had with truly devastating COVID numbers and a great public health response in return. And now with this vaccination push, to see them here is really great.
It really is. And Dr. Hlatshwayo Davis, what do other cities and states need to do to get to the same point as San Francisco?
Buckle down and respond to the needs of their public. You know, my greatest area of concern right now is in the conservative South, where we're seeing, 25 to 35% vaccination rates, which is just way too low in order for us to reach that July 4th deadline that the president has set, and that we need, quite frankly, especially in the wake of the Delta variant that is going to pose a threat in places where folks are not vaccinated. It's absolutely imperative that we do that we think about why folks aren't getting vaccinated, that we understand the nature of the folks who are still unvaccinated and why they may not have that vaccine confidence. Are there access issues? Here in St. Louis, I sit on the Board of Health, as you told folks, and we had to respond to folks who just couldn't leave their house, even for a short period of time, because of health concerns or other responsibilities. So we partnered with our local transport department and the fire department to take vaccines to people's home. And this was under the leadership of Dr. Fred Eccles, our Commissioner of Health. These types of innovative strategies are key in individual places to get folks vaccinated.
Well, you know, there's also misinformation, and there is fear about the vaccine as well. I want to ask you about an Ohio doctor and anti-vaccine advocate who told state lawmakers there on Tuesday that coronavirus vaccines can leave people magnetized. Other experts have previously denied these claims and have traced the origins of these theories to Russia. Please tell our viewers, what is the truth about the safety of these vaccines?
It's really upsetting to hear reports like this. You know, I come from a community that has valid mistrust for this vaccine based on both historic and current prejudices, atrocities against communities of colors in the name of science. You know, it takes a lot to earn back that trust. So to then spread misinformation just is not acceptable. My question would be, where is the data? You know, as someone who comes from one of those communities, the reason why I use this platform to spread good data, good news, and information that comes from sound clinical trials and research and actual science, I have to ask where the data is, and that's what I encourage folks to ask. You know, we all enjoy social media, for example, but if you're on Facebook, Twitter, Instagram, and you get a link, you get an article, someone is making a claim, you need to ask yourself, where is the data to support it? We need to lean into trusted messengers and trusted resources. For me and my field, that is the Infectious Diseases Society of America. That is folks like Dr. Fauci, Dr. Rochelle Walensky, the CDC, and the NIH. And if those aren't trusted resources in your mind, then again, I ask you, where is the data? Show the data. But if you don't have it, do not spread misinformation that can literally cost people their lives.
The White House is reportedly planning to donate 500 million doses of Pfizer's vaccine to countries around the globe. You and I have discussed in the past the importance of global vaccination efforts. These vaccines will be distributed over the next year. How big of an impact will this have on global vaccine disparities?
It's such a critical first step, Lana. I cannot tell you how relieved I am, and I know folks like me are, to hear this news, because there is such a discrepancy in vaccine equity across the globe. An astounding statistic that was released this week, that if you look at vaccination rates per continent, we're looking at 61 doses per 100 people in the United States. Compare that to Africa, where I am from, 2.4 versus 61. Therefore, to see President Biden make such a huge donation by way of 500 million vaccines, financial support coming too, especially just ahead of the G7 summit this week and talks this week, is imperative so that other countries can take heed and follow in line. But let's be clear, this is just a first step and short-term response. In the short term, sure, we need donations and even raw materials. But in the long term, this doesn't get done without increasing global manufacturing capacity and increasing oversight infrastructure.
It's interesting, as you say, that this is a first step, because Dr. Anthony Fauci said that the U.S. cannot, quote, declare victory prematurely just recently. Mm-hmm. At what point, given that pandemic, by its very nature, a global pandemic is global, at what point can we say that we have won this fight? And what factors will determine when we do?
For me, it's about equity. It's about equity globally, right? That statistic I read you tells us we're not nearly there, because a threat in one place affects us all, Lana. You know, we are in summer. We're opening up our borders. International travel has started, and we are a global community. So if we start having folks who have been vaccinated, who are in great vaccination rate jurisdictions, going to others where they aren't, we're right back to square one. And again, this in the setting of a Delta variant in play. We cannot prematurely say that we are there. We are there when we reach herd immunity. We are there when we have vaccine equity. And we are there when those numbers are represented globally. It absolutely has to happen.
Dr. Monty Hlatshwayo Davis, I love the passion behind your voice. Thank you for coming on, and thank you for all that you do.
Thank you so much for this platform and for asking the questions that folks need to hear, Lana. It's so imperative. Good to see you, and I'll see you soon.